My name's Gail. I'm a childbirth educator. Today we're going to talk about key points of childbirth, beginning with the anatomy of the uterus, signs of labor, preterm labor, warning signs to call your doctor, the difference between true and false labor, and stages and phases of labor. Stage 1 consists of 3 phases: early, active, and transition. Stage 2, pushing and delivery. And stage 3, postpartum. Well, let's get started. Your uterus is where your baby lives. This is your baby's home. The amniotic sac lines the inside of the uterus, and everything inside that amniotic sac is sterile, including the amniotic fluid that the baby floats in and the baby. So the baby is in its own sterile cocoon. The placenta is an organ that's attached to the uterine wall that exchanges nutrients and waste byproducts to and from the baby by way of an umbilical cord. The cervix is the mouth of the uterus. The cervix leads into the birth canal or the vagina. And as the class progresses, we're going to talk about how the cervix relates to labor. Well, let's talk about labor. How does labor start? There's a hormone from your brain called prostaglandin. Prostaglandin causes the cervix to soften or ripen like a piece of fruit. That softening stimulates your brain to release another hormone called oxytocin. Oxytocin causes the uterus to contract, pulling on the cervix, causing the cervix to thin and shorten. That is called effacement. Continued strong uterine contractions causes the uterus to pull harder on the cervix, causing the cervix to eventually open or dilate from dimple-like your rectum to 10 centimeters dilated as labor progresses. But we cannot talk about the progression of labor until we understand the difference between a Braxton Hicks and a true labor contraction. A Braxton Hicks is a mild, irregular contraction occurring 2 to 3 times a day that does not thin, shorten, or open the cervix. There's no cervical change. A true labor contraction is a Braxton Hicks that has gotten closer, stronger, and does eventually change the cervix, efface and open the cervix, and dilate the cervix as labor progresses. Well, let's talk about signs of labor. Signs of labor is when these Braxton Hicks are starting to get closer, stronger, along with menstrual cramps, lower backache, lower pelvic pressure, nesting, you want to clean, and maybe a change in your vaginal secretions. But what happens if these signs of labor occur before 37 weeks? This is considered to be preterm labor. What are the signs of preterm labor? More than 4 contractions in an hour, along with menstrual cramps, lower backache, lower pelvic pressure, and maybe a change in your vaginal secretions. So what happens if you have these symptoms of preterm labor? What do? You call your doctor. What are other reasons to call your doctor? Other warning signs to call your doctor: vaginal bleeding, leaking of fluid from your vagina. That means there may be a hole in your baby's sterile cocoon. Headache, not relieved with Tylenol. Blurred vision or seeing spots before your eyes. Sudden swelling of your face and around your eyes. Decreased fetal movement. Fetal movement is the #1 way we know your baby's doing well in utero. So I want you to do a fetal kick count once a day. Your baby should have 2 active periods of the day. Your baby should have 4 movements in 1 hour or 10 movements in 2 hours. If your baby's had a change in the activity, if its normal movements have changed, then you need to eat, drink something cold, lay on your left side, put your hand on your tummy. If your baby still does not give you 4 movements in 1 hour, you need to call your doctor. Another reason to call your doctor is if you're in true labor. What's true labor? What is the difference between true labor and false labor? True labor is when your contractions continue to get closer, stronger with activity, like walking, birthing ball, keeping your bladder empty, increasing fluids, and intermittent periods of rest. Your contractions are getting closer, stronger. But with false labor, your signs of labor or your contractions spread out or go away with activity, drinking, keeping your bladder empty, and resting. So that may save you a trip to the hospital. So now let's go into stages and phases of labor. Stage 1 consists of 3 phases: early, active, and transition. Early labor, your cervix goes from dimple to 3 centimeters dilated. Where are you at in early labor? You're at home. Why are you at home? Because it's relaxing at home. What do you eat in early labor? You eat lightly, because if you eat heavy, digestion slows down and you might become sick. So eat lightly. Now I'm going to talk to you about an acronym, and that acronym is PURR. This is going to help you work with your body and help you relax. P for position change, U for urination, R for respiration, and R for relaxation. So let's start with P. P for position change. You want to rotate your position throughout labor every 30 minutes. Being upright as much as you can, allowing your baby's head to put more pressure on the cervix, which will accelerate your speed of labor. What positions are these? Standing, walking, birthing ball, rocking chair, or taking a shower. And this is throughout labor. U for urination. Keep your bladder empty. It decreases your discomfort. R for respirations. Breathing is your main attention-focusing strategy in labor. What does breathing do for you? It distracts your mind away from the incoming sensation, which is the contraction. Breathing oxygenates your uterus, making it more receptive from the oxytocin from the brain, giving you more stronger regular contractions. Breathing oxygenates your muscles, decreasing muscle tension, decreasing pain. We are now going to talk about 2 breathing exercises: cleansing breath and slow-paced breathing. Cleansing breath is done at the beginning and the end of every single contraction. Slow-paced breathing is done throughout the contraction, slow breathing in and out and counting to distract your mind. Today, when we practice, we're going to count to 4. I want you to picture in your head a hill, and that is the same shape as a contraction. At the beginning of the contraction, we're going to take a big breath in, big breath out, and drop our shoulders. And that is a cleansing breath. Throughout the contraction, we're going to do slow-paced breathing, counting to 4. In, 2, 3, 4, out, 2, 3, 4. In, 2, 3, 4, out, 2, 3, 4. In, 2, 3, 4, out, 2, 3, 4. Big breath in, big breath out, and drop your shoulders. Great job. Now the last R is relaxation. You've got neuroreceptors located all over your body. And when you stimulate these neuroreceptors, you release a hormone called endorphins. Endorphins is a natural relaxation. So how do you elicit the release of endorphins during labor? Brushing your hair, chapstick, walking, birthing ball, rocking chair, taking a shower, heat cold, warm blanket, cold washcloth, music. Music releases endorphins, brings back positive memories, and when you sing, it oxygenates you. Aromatherapy. Think of a smell you love that brings back positive memories. So you have a sandwich baggie with cotton balls. You can pour vanilla oil or cinnamon oil, and when you get into labor, you've got a release of endorphins and bringing back positive memories. So now you're at home, you're rotating position every 30 minutes, you're hydrating yourself, you're keeping your bladder empty, and you're having intermittent periods of resting where you're timing your contractions from the beginning of one to the beginning of another. And you're going to call your doctor when your contractions are regular and strong every 5 to 7 minutes apart. Now when you get to the hospital, hopefully you are in active labor. And active labor is 4 to 7 centimeters dilated, and this is your visual. What are you doing in active labor? Changing your position and rotating your position every 30 minutes, staying hydrated, keeping your bladder empty, walking, birthing ball, but you're starting to get uncomfortable. You might want your epidural. An epidural is a catheter that's inserted into your lower back outside of your spinal column in the epidural space. The epidural catheter is connected to an infusion pump that gives you continuous pain medication. It does not affect breastfeeding. But the main side effect of an epidural is a drop in the blood pressure. So your nurse will start an IV and give you a liter of fluid, like a liter of Coke, to prevent a drop in the blood pressure so anesthesia can insert your epidural. So now you're in bed with an epidural. Can you still rotate your position every 30 minutes? Yes. Far right side for 30 minutes, far left side for 30 minutes, and then put the head of your bed upright to allow your baby's head to put more pressure on the cervix to accelerate your speed of labor. So now you're in bed in active labor. You're rotating your position every 30 minutes. You're breathing, you're focusing, you're relaxing. As time goes on, now you're 8 to 10. That 8 to 10 is transition. Okay? Transition is really important also for you to rotate your position. So do not stop rotating your position in transition. You want to breathe, focus, relax, stimulate nororeceptors. As time goes on, now you're 10 centimeters dilated. Once your cervix is 10 centimeters dilated, you are not having any pain anymore. But you will have, through pushing, you will have pressure. So when your cervix is 10 centimeters dilated, you're going to be pushing your baby through the birth canal. Remembering, you will have pressure. You're going to have a one-on-one nurse through pushing. For a first-time mom, you may have to push up to 2 hours, and this is normal. But now your baby is born. From that point to 6 weeks later is postpartum. During postpartum, you're going to be very tired. So please take naps with baby in the hospital, but especially at home when you're having all those distractions. You're not going to have an appetite, so please try to eat frequent, healthy, nutritious snacks every 2 to 3 hours. Fruits, vegetables, trail mix. That's going to keep your blood sugar level up, helping you physically and mentally. Mentally, you're going to have a lot of fluctuating of hormones in your body. Because of these fluctuating hormones, some moms have prolonged crying and sadness. Please do not be embarrassed or ashamed. There is postpartum support groups available to you in your community to help you and support you. Thank you and enjoy your baby.